A paper published by Coolidge and colleagues in 2000 stated that gender identity can be understood to be much less a matter of choice and much more a matter of biology. It used to be believed that children were psychosexually neutral until the age of 2, which we now know isn't the case. Historical studies indicated that children born with ambiguous genitalia could have surgical modification, be reared unambiguously in the gender role consistent with their surgically modified genitalia, and it was thought that this would inevitably lead to a congruent gender identity, implying that gender identity could be determined purely by how a child is raised. However, this was often accompanied by a policy of secrecy, and many children who were put through this regard their gender role as surgically created. Now, there was a case of gender identity development which had a huge impact on our understanding of how gender identity develops, involving a person called John or Joan. These names are pseudonyms. As a child, John lost his penis during a circumcision accident, and it was recommended that he was surgically assigned and raised as a girl called Joan. Joan was not told that he was originally assigned male, and as he had a twin brother, he became an almost ideal test case for the concept of gender identity, as they had shared genes, intrauterine environment, and family environment. Initially, this approach appeared to be successful. However, despite psychological treatment to make Joan more comfortable as female, he reverted to being John as a teenager after experiencing suicidal depression at the age of 13. At the age of 15, his parents told him the truth about his gender. John married and became a stepfather to his wife's children. In 2002, he lost his twin brother to an overdose, and in 2004, his marriage broke down. Shortly after this, in 2004, John, whose real name was David Reimer, died by suicide. The pain, anguish, and immense psychological difficulties that David endured during his childhood have been instrumental in shedding light on the psychological development of male and female identity, and have been a catalyst for change in the medical approach of managing the care of infants with traumatised or ambiguous genitalia. David's suffering has a lasting legacy in the impact of ending or avoiding the suffering of many others. Now, many might say children cannot possibly know that they are transgender, and this is an argument that rages back and forth. Yet what we know from the John/Joan case and many others is that children are born with an innate sense of their gender identity, and no amount of consistent socialisation or hormone therapy can override this. Autobiographical accounts of transgender adults indicate that they were aware of a discomfort that they were unable to articulate or express during childhood. The result is that they tend to give in to the societal pressure to conform to the traditional gender expectations, and especially the expectations of family, friends, and society in general. Where there is greater freedom of expression in many cultures which have a less polar approach to gender expression, studies suggest that the likelihood of dissonance is lessened and comorbidities may be reduced as a result. In Western societies, most transgender people report going to huge effort to fit into the stereotypes, which often results in a more challenging transition in later life, as they've always given an impression of conformity. This perhaps only serves to make them more acutely aware of the dissonance that they're experiencing. It's not uncommon for LGBTQ+ adults, especially trans men and trans women, to grow into adulthood with stereotypical pastimes and careers. The desire to fall in love, to have children. Some hope that a stable family life will lessen their gender dysphoria, which in turn, when they do transition, can put their family relationships, friendships, and employment at risk. The need to transition can become overwhelming, and it is no exaggeration to say that for many, this can be a matter of life and death.